Okay, so fun fact, necrosis comes in many fun, delicious flavors. Let's talk about them. Okay, so coagulative necrosis is the kind of necrosis we see when cells die really fast. Usually that means we've cut off their blood supply very rapidly and they dead really, really quick. So this is the one where they almost don't know they're dead yet because it happens so fast. That's like this tongue. This one, right? Happens so fast. This is coagulative necrosis. It results in coagulation of the cell protein, so it's like cooking an egg. You picture a raw egg in a frying pan as it's cooking. The proteins are solidifying, coagulating in place. So what happens here is all the cells die in place. They don't have any time to fall apart or start degrading or come disconnected from each other. They're all still fixed in their normal architecture. They don't know they're dead. So you get these ghosts of outlines, but tissue architecture is retained. The necrotic tissue holds together. It is not soft yet because it happens so fast. These are often extremely sharply demarcated. So this lesion that we talked about earlier in the cow muscle is very, very well demarcated. And they're often very pale because they're induced by ischemia, which is cutting off blood flow. These lesions don't have blood in them. So this is pale necrosis, usually if it's ischemic and coagulative. Here's another example. This is horse kidney. I would say multifocally, this is multifocal coalescing here. In the cortex, there is a fairly well demarcated area of pallor with very mild swelling. I'm following the contour of the kidney here. I can see that this is a little bit raised compared to the adjacent. Can you appreciate that? It's way subtle. These are like pathologist size. So it's a little bit swelling. We're getting a little bit of early swelling, but tissue architecture is retained. This still has the shape and the contour of the kidney, right? This tissue is mushy or falling apart or gone. It's not like this fold in the tongue where there's scoop in here, nothing is sloughing. Everything is still where it was right before it died. Here's what that looks like on histo. Again, it's like cooking an egg. So here's live hepatocytes. Here's dead hepatocytes. They're the same shape. They're still arranged in hepatic cords. They still have all their little support cells in here, but these guys are dead. There are no nuclei. Their cytoplasm is hyper eosinophilic. Eosinophilic means pink. It's too pink. And look, if we zoom out a little bit, these areas of necrosis are extremely sharply demarcated, very well demarcated. I can draw a line between normal and abnormal. So easy. So coagulative necrosis, super acute, retained tissue architecture, often ischemic. Doesn't know it's dead. If you have liquefactive necrosis, tissue definitely knows it's dead. In fact, it's being enzymatically digested. So these enzymes come from both bacteria. Bacteria are digesting your tissues if this is a bacterial infection, but also your dead cells. You have to have the enzymes to break down cell components to recycle them. So all your cells are little bags of enzymes, lysosomes, lysozyme, reactive oxygen species. So when cells die, they release that stuff and it starts to liquefy the tissue around it. So liquefactive necrosis is what it sounds like. The tissue is liquefying. We have lost tissue architecture, comparing to coagulative. So this brain that we looked at, this is liquefactive necrosis. In fact, liquefactive necrosis is the stereotypical form of necrosis in the brain. We also call it, I don't have captions today. We also call it malacia.
Say that again.
I don't have captions today.
No.
Malacia, M-A-L-A-C-I-A. It means softening. So when we have liquefactive necrosis in the brain, we call it malacia. Again, it's necrosis, so the color is variable. It depends what's going on around it. If there's hemorrhage, it's going to be red or dark red to black. If it's got white cells in it, it's gonna be white pale. Think of the consistency of pus. This is also the type of necrosis we see when we have bacterial infection in tissue. Because neutrophils are also little bags of digestive enzymes. They come in there and bark in the tissue and it liquefies everything around. They're like little kamikaze barfers. Okay, so histo, remember with coagulative, we have a really sharp line of demarcation. You notice there's no inflammation here. There's no red rim yet, it's too early. We're so acute that we have beat the inflammatory cells. They are not here yet in coagulative. No inflammation yet. In liquefactive, for sure there is inflammation. We're making a big mess. We've liquefied cells. They're releasing all kinds of pro-inflammatory stuff. There might be bacteria in here. So the pink is the vast pink wasteland. That's the necrosis. And then this blue rim, nuclei stained blue. So all of this blue is inflammatory cells surrounding the necrotic area because it's calling in inflammation. There's another example, coagulative versus liquefactive. These are both kidneys. Yes.
So in like the previous slide, you're talking about. We've got cell death, we've got liquefaction, and then are we, like, is there any chance the body could like build a wall of cells to like keep the necrosis in one spot?
Week 5. A wall is made of fibrosis.
Oh,
So
okay.
if we see a wall that tells us it's a chronic lesion. Necrosis is typically an acute change. So we're dealing with very acute stuff right now. Good question. All right, a tale of two kidney here. This one, can you still tell this was a kidney? That's like the ghost of glomerulus and the ghost of tubules, but this shit dead. There are no nuclei here, so these are not live cells. Depending on what's going on, autolysis can look this way, so it has to be in the context of everything else. If this was from this kidney in this area, I'm gonna be able to tell that that's necrosis and not autolysis because I'm gonna have tissue reaction, especially at the border. So this is another important pathology, big picture concept. When you sample a lesion, the best place to look is at the border between normal and abnormal, the active front, because that's where the good stuff is going on. This happens super acutely, there is no inflammation, but if I zoom out in bigger context, there will be a sharp rim of demarcation between this area and between adjacent, healthy, non-autolyzed kidney. Thank you. Yeah.
I have a different question. Are both of these well demarcated because the liquefactive still has like the definitive ring of information around it, or can you not say
Are you
that
talking about these images or the stuff in general?
this stuff?
The stuff in general, I would say that usually coagulative is more sharply demarcated than liquefactive. Liquefactive is messy. Coagulative is like. That sound make any sense.
So it's the entirety of the left slide.
Yes, so I can't tell you demarcation based on this image because I don't have any normal tissue. It's another reason to include normal in your sample, so I can tell you the demarcation.
But on the right, you have just that area.
On the right, here's an area of necrosis, here's a blue rim of inflammation. I would say this is not very well demarcated. It's got kind of a blendy edge here. Like all this is like inflammatory.
But there's normal tissue on like.
But there is normal tissue. Yeah, so I can tell you that this is not very well demarcated because I have normal. Okay, again, the inflammatory response is different. Coagulative happens so fast that if you catch it in that very acute phase, you're not really going to see a lot of inflammation. Liquefaction is often associated with bacterial infection, so there's often a lot of inflammation in liquefaction.
In the image on the right.
Yeah.
Are the darker purple flecks part of the inflammation response?
All of this purple, like from
Like
here,
or red?
the red,
Yeah.
that is part of the inflammatory response. Those are congested blood vessels. Remember I said that one of the first things that happens in acute inflammation is your blood vessels dilate to allow inflammatory products and cells to come in. That's what you're seeing, and you see that as part of the red. That's what makes the red red. It's not the white cells, right? It's the red cells. Make sense? Delicious. Caseous means cheesy. So caseous necrosis means cheese-like necrosis. So for all the pathologists that don't like delicatessen pathology, take it up with the textbook, because this is what we call this stuff. I didn't think it. Cheesy necrosis. So this is usually an area that starts as liquefactive, but how the body handles that over time is it's going to reabsorb all the water out of it, and the pus is going to get crumbly and dry and cheesy. It's going to be like feta. So the word for pus getting all the water sucked out of it and becoming dry and rubbery is inspissated. Pus is becoming inspissated. Say it again. So these are basically old areas of liquefaction. They've been sitting around for a while. We've taken all the water out. There's often dystrophic mineralization associated with it, which kind of contributes to the cheesy, chalky, crumbly, gross texture. So it's going to be dry, chalky, granular, chunky. Importantly, this describes a gross appearance. I can't tell caseous from liquefactive on histopathology. It just looks like vast pink wasteland. So caseous only describes if I give you a gross image, you could say, oh yeah, that looks like caseum. Caseum is the noun, caseous is the adjective. So this material is caseum. This is a lymph node from a sheep. The lymph node is diffusely, massively enlarged and effaced by almost lamellar, like layered, like a jawbreaker. See how it's got kind of layers to it? Lamellated, soft, dry, crumbly, inspissated material. Inspissated is an adjective. I can use it as a descriptor. Thank you very much. This type of necrosis is strongly associated with granulomatous inflammation. Don't worry about that too much yet. That's a week 5 thing. That's chronic inflammation. So when you think of tuberculosis in humans or cows or anybody else, TB is the prototype for a caseating lesion. If you think of what that looks like, the jawbreaker with crumbly feta cheese inside. It's also extremely common in non-mammals, so birds, reptiles, fish. Their neutrophils don't have the enzyme myeloperoxidase, so those species cannot make liquid pus. They are not capable. So their default is granulomatous and more caseating inflammation. Here's an example. Yep.
So you mentioned that caseous necrosis develops from liquefactive necrosis, but in those non-mammal species, they can't make liquefactive necrosis, or is that different from liquid pus?
They can't make liquid pus.
Okay,
They can have liquefactive necrosis. They just can't do it with pus. It's not their they don't even have neutrophils. They have heterophils, which are like a neutrophil equivalent. Don't worry about it. So this is the first lesion we've talked about that is a little bit more chronic. The other types of necrosis are usually acute. If you leave liquefactive sit over time, it will become caseous. Granulomatous inflammation is also chronic. So this one is associated with a little bit more long-term chronic processes. If you look really close at this sheep node, it actually has a rim of fibrosis. This white tissue that's around it is fibrosis. So that tells me that this is a chronic lesion. This has been going on for weeks to months. All the time. Here we have on histo. So here's the caseous necrosis. Pink wasteland looks just like liquefactive. I don't really call things caseous on histo unless I've seen the gross and I can infer it from the gross. However, in this slide, I have multinucleated giant cells, which are a hallmark of granulomatous inflammation. These are all macrophages. There's a capsule around this. So this fibrotic tissue, this is basically a scar tissue capsule around it. So this is something that the body can't deal with and it's trying to wall it off every forget who asked that question, but that's what this is, right? We cannot deal with this, so we're trying to just sweep it under the rug, don't worry about it, you lock it in the closet, but we have a little focus of caseous necrosis. All right, good example of this disease, the term is actually in the title, so it's easy to remember. So has anybody seen a case yet of caseous lymphadenopathy in a small ruminant, sheep or goat, a couple? It's pretty epic. This is a bacterial infection. It usually gets in through like tail docking or castration or shearing, some kind of wound. And what happens is this bacteria loves macrophages. It can infect macrophages without being killed by macrophages. So it gets in them, hitches a ride to the lymph nodes where it goes crazy. So these are all lymph nodes. This is lymph node, blump, 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 all lymph nodes. Just like that, this picture, this is also caseous lymphadenopathy. Here's another example where it's more lamellated, it has these layers. So this thing, if you can kind of imagine this lesion going through time, it started as like a little pearl. We tried to wall it off and we couldn't, and we tried to wall it off and we tried and tried and tried. And now this thing is huge because we cannot get rid of this bug because it's in our macrophages. It's like a Trojan horse, right? It's in the cell that's going to help us clear a bacterial infection. That cell is not going to be helpful because it's housing these guys. It's complicit. All right, so that bacterial infection causes massive chronic caseous necrosis of lymph nodes. You can also get these big kind of abscesses in internal organs. It's gross, but if you love pus, it's a good disease. All right, next type of necrosis is fat necrosis, aka necrosis of fat. So this isn't really a special type of necrosis, it's just how we describe fat when it becomes necrotic. Fat as in adipocytes, not as in fatty liver. This only happens in fat as in adipose. So fat has a lot of lipases in it, inflammatory cells, a lot of lipases to release your fatty acids from your fat so you can metabolize them. So when fat becomes necrotic, you release those fatty acids, you're releasing calcium from cells because cells are dying. Calcium with fatty acids makes soap. That's how we used to make soap in the old days. So this is called saponification of fat. That literally means soapification. Fat is turning to soap. What that looks like in fat, the fat becomes very firm, almost hard, with multifocal white chalky deposits in it. That's mineralization, that's dystrophic mineralization, all these little white areas in here. There may be inflammation because lipid is inflammatory, so you may have a little bit of inflammatory response. It's extremely firm compared to normal fat, and it has this chalky, gritty texture. A couple different causes. So enzymatic, animals that have pancreatitis, your pancreas is a bag of digestive enzymes. So if you release enzymes in your abdomen around your fat, you will get necrosis of your fat. Digest your fat, that's its job. You can have traumatic fat necrosis. So we see this sometimes in the brisket of large cattle. They crush up against a gate or something. They can crush that fat, cause necrosis of the fat, saponification of fat. There's also idiopathic. So sometimes cattle, their abdominal fat, their mesenteric fat will saponify. They don't really have pancreatitis. We can't really find a cause. It's idiopathic. We're idiots. We have no idea what is causing that mess. Okay, and then one last quick one, gangrene. Oh yeah.
How would you differentiate between fat necrosis and caseous?
Caseous necrosis is basically inspissated liquefactive necrosis. So it's one type of necrosis that's just kind of aging. This is like aged necrosis. This is necrosis of fat. This can happen anywhere there's liquefaction. This can only happen in fat. And it's because you need the fat plus the calcium to make a soap. It's the only thing special about it. Fat only for fat necrosis. Other questions? I got 2 minutes, let's do gangrene. All right, gangrene describes coagulation necrosis plus the stuff that happens after it. So it's like coagulation and then stuff in the environment. If you are in a wet, gross, buggy, humid environment, you get invasion of saprophytes. Saprophytes are bacteria that like live in the environment, in the dirt, they digest decaying plant matter, they're not really a problem. But they will invade that dead tissue because that's their job, they're organisms of decay. That's wet gangrene. Coagulative necrosis invaded by environmental bacteria is wet gangrene. If you're somewhere dry, if you're in the desert or you have frostbite or you've eaten ergot and you're constricting your blood vessels and you're getting ischemia of all your digits, you're in a dry environment without bacteria, you get dry gangrene. It's like a mummification versus the liquefaction. So that's like frostbite. Wet gangrene we see a lot in intestine because you can't get away from bacteria. So a necrotic intestine will very quickly become gangrenous because all the bacteria will just start eating it. And then finally, gas gangrene. This is usually associated with invasion of Clostridial bacteria, and they are very gassy and super stinky. So gas gangrene is usually black, bubbly, and smells hella bad, like rancid butter. Nothing smells like anaerobes, you guys, so gross. I used to work in bacteriology and we had a big chamber to work with anaerobic organisms and it had the big glove sleeves. You would like stick your arms in a box. The sleeves were like thick rubber, but every time my arms would come out and they smelled like anaerobes for the rest of the day, no matter how many times I washed them. Anaerobes are so gross and stinky. I love them. All right, so we stopped yesterday talking about gangrene. It's a little bit confusing, but don't worry about it too much because this is like an old-timey word that we don't use a whole lot, but you need to understand it because it does pop up occasionally from old-timey vets and with certain diseases. So for you guys to know, the important thing is gangrene starts with coagulated necrosis. That's the cooking an egg, often ischemic. And then the gangrene part comes in with whatever happens to the tissue after that, what environment it's in. Is it dry or wet? Are there bacteria? Are the bacteria saprophytes or are they anaerobes that are stinky? That's it. Okay, so wet gangrene, again, this is coagulation necrosis plus invasion of saprophytic bacteria. We're looking at 2 mammary glands and a lung here. Let's start with this mammy. So in describing this, I would say there's a couple things going on here. There's this lesion right here. You guys have a word for that now. What is this? That's an ulcer. Yep, we have exposed the underlying, what? There is nothing because it's yeah. Yeah, so we've lost the epidermis and we've exposed the underlying dermis and it's red and raw and bleeding. This is an ulcer, but there's much more lesion here. So do you see the color of this skin compared to this skin over here? And also this skin up here. This is normal. This is a little bit red. It's got a little bit of flush to it. And then starting around here, all this that I'm tracing, I think this skin is all dead. It is acutely dead. It doesn't know it's dead yet. It's still retaining its architecture, still is skin textured and shape, not quite color. It's a little gray because it's lost the blood supply. All the skin is dead. And then there's also some smaller, maybe not ulcers. These might be erosions. They're not quite as severe as this. Maybe they're not quite as deep, but we've also got some mucosal, some epithelial here. This one has not started to swamp yet, but about 90% of the mammary gland is discolored, dark red to purple, black. Maybe some yellow areas in here. So this is severe acute inflammation. This is again coagulation necrosis plus bacteria. This is these are both cases of gangrenous mastitis. That's one of the places you still hear that term used to describe this one, mastitis. And then here we're in a lung. Here is a cut section into the main stem bronchus. And all of this black, discolored, poorly demarcated. It looks soft, it's kind of losing its architecture. This is all gangrene in the, or coagulation necrosis plus bacteria.
So, because it's necrosis, we know that the tissue is dead or dying.
It's dead.
It's dead.
Dead.
So why would we call the, like, that thing an ulcer rather than sloughing if the tissue is dead?
Well, usually an ulcer is the response of the body to when that surface tissue dies. Right, so it either dies and individual cells fall off, or it slides off in a piece if it dies really acutely.
So the tissue underneath is not dead, it's just that first layer of skin that you're saying is dead?
There, so it's bleeding, so it is still at least a little bit alive. Yeah. But things are not looking good. Yeah. There's probably a lot of degeneration happening. There probably is necrosis in there, but the really obvious necrosis in the picture is the epithelium is turning gray and falling off.
In order to differentiate between, I don't know, like, other kinds of necrosis and injury, we then use like a microscopic view.
I don't care about you distinguishing gangrene. I just want you to know it. I want you to know liquefactive and coagulative. Those are the big ones. And then fat necrosis and cheese necrosis and all the other little flavors. This, I just want you to be familiar with it. Don't worry about it. Seriously, no big deal. Gangrene is just necrosis. Here's dry gangrene. So this is where you have basically mummifaction of tissues rather than putrefaction. So this is happening in a dry, sometimes a hot or very cold environment. So this is things like thermal injury, frostbite, organ fescue, things that cause ischemia and loss of blood supply. So here we're looking at the back of a pig's head. We have cut off his head. Here's his little brainstem. And we're looking at the backs of his ears. For these, I would say that bilaterally, about 50% of the distal pinna is discolored dark black. There is a sharp line of demarcation. The affected tissue is firm and dry. Here's a tail. It's a pigtail. We cut it in half. Again, we have a relatively decent line of demarcation, although there are some skin changes that extend a little bit further back. But again, I would say there is a sharp line of demarcation. I don't even know what percentage of tail this is. 20% of the tail, distal tail tip is discolored, dark, black, firm, dry, desiccated. It's a good word you could use for these tissues. And then here, everybody see this guy's foot, little sad gangrenous foot. So this is in little birds and little pocket pets and stuff. They can sometimes get bedding material or string or other things wrapped around their extremities. That causes acute loss of blood supply. Dry gangrene if you're in a dry and warm environment. Gas gangrene. So this specifically refers to invasion with Clostridia, which are anaerobic bacteria. They stank and they fart. So there is a lot of gas in the tissue when you have involvement of Clostridia. Here's a case of gas gangrene. You can see all these bubbles. We're looking at muscle tissue here. So this part is muscle. This is some fat and fascia. I would say diffusely, at least within this field, the muscle is pale, swollen, gelatinous, and has numerous cystic cavities inside of it. I would say that this tissue also has an odor of rancid butter. It smells very bad. These two images, anybody know the name of this disease? How would you describe this? This color plus this tissue. This is black leg. Hooray. This is a leg. There's a hoof. What? There's a ankle. There's like an elbow. It doesn't have any skin on it. That's why you may not recognize it as leg, but it's leg. There's a foot. So this is black leg. Here's some more skeletal muscle. You can see moderately well demarcated area of dark black discoloration surrounded by lighter red discoloration. So here's that red rim of inflammation surrounding the necrotic area. This is a viable, healthy red. This is dead, black, nasty necrotic. I would say the affected muscle away from the black area is also not quite normal. It's pale. If this is beef, and you saw this color of beef in the supermarket, would you wanna buy that? Nope, it ain't right. So it's swollen, it's pale. You see all these little spaces in between muscle fibers? They're expanded a little bit because we have fluid building up in there from inflammation. So this is what I mean by, I want you guys to get really good at noticing things. Yes, there's this really big obvious lesion, but there's actually a lot more going on in this picture that's a little more subtle. There's this red rim, there's swelling, there's some discoloration. There's like an excess wetness to the tissue. This muscle is kind of glistening, and usually muscle is kind of dry when it's healthy and you cut into it. So this is all swollen. This stuff also smells hella bad. Unforgettable smell, anaerobes. Questions about necrosis or gangrene or degeneration?
It was. But the injury on the left, called it cystic.
I said there are multiple cystic cavities inside of the muscle. Okay.
Cystic, gonna be like, really comes out.
Nope, just means there's a space there.
Okay.
So again, descriptors and interpretations, descriptors are adjectives. I have had an ick onto the word cyst to say that these structures look like cysts. I am not saying they are cysts. So I would not say there are cysts in the muscle. Cysts is a noun, it's an interpretation, it means a specific thing. Saying there are cystic spaces, there are holes in the tissue. I could also just say there are holes in the tissue.
For the holes in the bottom right, would you say they're also cystic?
Holes in the bottom right
They're like little.
of this image?
Bottom.
Oh, this,
Right, yeah.
I don't see holes in this image. I see this is probably a blood vessel. This is like a fascial plane between muscle bellies.
Well, when you were describing, you said there's little spaces between muscle fibers.
Oh. Yeah, so I'm looking at like the texture of the muscle. So all these little lines between little lobules, they're a little bit expanded, especially down here.
Yeah, and there wouldn't be cystic cavities.
They're not cavities, there's just fluid in there that's causing a little bit of expansion. These are cystic holes, they're gas bubbles. I could just call them gas bubbles if I was confident, that's what they were, wish I knew.